Hello, and welcome to the Council of State Governments Justice Center's Toolkit on Community Responder Programs. My name is Dr. Aisha Delaney Rumsey, and I'm the Director of the Behavioral Health Division at the Council of State Governments Justice Center. We are a nonpartisan, nonprofit organization working with government leaders to support improvements to justice systems across the country. We're excited to offer this toolkit as a resource in support of your journey to establish or sustain a community responder program. In this video, I'll define community responder programs, then I'll briefly explain why communities are building these initiatives, and finally, I'll share tips for using the toolkit. Now, community responder program is a broad term, and while the exact name and structure of these interventions vary, most meet two general criteria. First, they are mobile units staffed by behavioral health professionals, such as social workers, peers, or community health workers. Those staff are also sometimes paired with a physical health professional, such as an emergency medical technician or paramedic. Second, these mobile units are deployed as first responders to 911 calls and sometimes to other urgent calls for service to reduce unnecessary law enforcement contact and improve connection to needed supports. They often provide services for a range of needs, including when someone is experiencing a behavioral health crisis, is in need of emergency housing, or when neighbors are having a dispute, and much more. Many community responder initiatives operating today are relatively new. However, the concept has been around since at least 1989, when the CAHOOTS program was launched in Eugene, Oregon. More recently, Atlanta, Austin, San Francisco, Portland, Rochester, and more have built their own community responder programs to fit local needs. After speaking with programs across the country, we've noticed some themes. They work best when they are built into a comprehensive system of supports, so that after they provide immediate care, they can also connect people to housing, treatment, benefits, employment, resources that bolster a person's well-being far into the future. And in addition to focusing on the needs of the person in front of them, many are also thinking about how they can help build systems that advance justice, support human dignity, and promote equity. Since 2020, calls for reforming 911 responses and law enforcement have intensified. Legacies of disinvestment from community care, as well as structural and institutionalized racism, have contributed to the criminalization of mental illness, substance use, houselessness, poverty, and the disproportionate representation of people of color in the criminal justice system. This has prompted agencies, including law enforcement, to ask themselves, how can we improve our 911 and crisis systems to support people's needs, rebuild trust, and protect public safety? Law enforcement and community members agree that the status quo is not working, and many jurisdictions have identified community responder programs as part of how to shift that status quo. This toolkit is intended to inform and support local governments, elected officials, nonprofit service providers, and other community-based organizations. The information presented here, which draws on the experience of communities that have successfully implemented these programs, is meant to help jurisdictions improve health outcomes, strengthen connection to health and social services, decrease unnecessary law enforcement contact, and support public safety. This toolkit is organized around 8 topics: building collaboration with key stakeholders and community engagement, conducting needs assessment and asset mapping as part of planning and implementation processes, staffing models for community responder programs, strategies for triaging calls, data collection and quality assurance, safety protocols and staff wellness, financing and sustainability, and finally, state and local legislative strategies to support implementation and operation of these initiatives. To maximize this toolkit's effectiveness, we recommend that you start by asking yourself what your goals are. For example, are you interested in designing and launching a new community responder program? Or are you looking to sustain an existing program through the addition of more flexible funding? Have you had a difficult time engaging key stakeholders? Asking yourself these and other questions to flesh out your goals will help direct you to the section of the toolkit that will best suit your needs. Once you've outlined your goals and identified the relevant toolkit sections, we recommend that you review the related briefs and web articles, as well as watch the available videos and webinars. While working through these materials, begin to write out how each resource can apply to your endeavor, any additional sections you want to review, and your next steps. We are always here to help. If you have questions, need clarification, or have feedback on any of the content provided, please reach out to us through the contact information listed on the toolkit. I want to take a moment to say thank you to the wide network of partners who helped us develop this resource with the support of Vital Strategies. As you begin this journey, please join me in honoring the people who have made this resource possible at this moment in history. For decades, communities of color have called for police reforms and reimagination of systems of safety and wellness. We thank those communities, as well as those individuals, activists, policymakers, practitioners, and many more who have worked towards the creation of community responder programs. Their pursuit of a system that promotes equity, well-being, and safety is what we aspire to support with this toolkit. Thank you, and I hope that this is a useful resource on your journey to establishing or sustaining a community responder program in your area.